One thing I've seen that a lot of people are concerned about, and this I've seen both like in clinic as well as personal life, kids getting a lot of shots at once. It scares parents. What do we say in response to that?
Yeah, having had kids and watching them go through getting shots, I felt as traumatized as they were when they were, just teeny tiny little things and getting all of these shots. But I think one of the things we need to realize is that, there's certainly some vaccines where we get protection from mom's antibodies until they're about 6 months old, but there's some where they're not protected against that. So we need to offer them that kind of protection early on. We also need to look at the schedule of kids. Do we need hepatitis B protection that early on when it's often considered an infection that really only people who use drugs get? Well, we have to understand that hepatitis B is also passed through sexual transmission. So, are we going to make sure that we get our kids vaccinated against hepatitis B when they are 10 years old, 12 years old, before the time when they're becoming, sexually active? So I think we try to get vaccines in as early as possible based upon when the child's risk is going to be. Also, making sure that we understand their immune system and how they're going to be able to respond to certain things and when they need this protection, when mom's protection is going to run out. And then understanding that when, you know, sometimes kids just don't get back to get their vaccines. We want to capture them when we can because it does take time away from school. It takes parents away from their work to get kids in for their pediatric visits. And certainly as you start getting into 10, 12, 14 years old, most adolescents don't go in for pediatric visits. So we really need to make sure that we're getting those kiddos their vaccines when we get them. HPV vaccine, most parents don't want to think their kids are going to be having sex until they're married, but we know that doesn't happen. So we need to get the HPV vaccine in them before they become sexually active. I mean, it prevents cancer. Hepatitis B and HPV are cancer prevention methods. They shouldn't just be looked at for, you know, because they're sexually related, that we need to worry about encouraging kids to have sex. We can prevent cancer with these, and that's how they need to be seen. So if patients or parents want to try and spread out the vaccines for their children when they're young, they need to work with their pediatrician, and they need to make sure that they are listening to the advice of when they need to get them. And then also they need to make the commitment to bring the children back in a timely fashion so that the actual vaccine series do get completed. So I think most pediatricians would be more than happy to work with families that have concerns about the bulk of those being given. But then that's the responsibility of the parents to follow through.